Hello. Welcome to the Standing Committee on Health and Social Development. Today is Wednesday, October 7th, 2020. First thing, could I get a motion to adopt the agenda? Jamie Fox. And just to introduce the committee members here today, we have Tricia Altez, Heath McDonald, Sydney McEwen in for Brad Trivers, Jamie Fox, and Hannah Bell. So without further ado, we're just going to pass it over to our guests. We're going to receive a briefing on the recruitment and retention of healthcare workers during the pandemic, and I'll pass it over to Lori and Rebecca, and they can introduce themselves and take over.
Sure. Hi everyone, I'm Lori Ellis. I'm Director of Workforce Planning with the Department of Health and Wellness. And I'm going to pass it over to Rebecca, who will be carrying out the presentation.
So hi everyone, I'm Rebecca Gill, and I'm the manager of the Recruitment and Retention Secretariat with the Department of Health and Wellness. So, is there a presentation? Yeah.
Okay. Oh, we're going to take a recess right now. Okay, we'll continue with your presentation. Thanks, Rebecca.
No problem. All right, so again, we're here to speak a bit today about the recruitment efforts with the province of Prince Edward Island during the pandemic, as well as recruitment and retention challenges that we faced as a result of the pandemic. And we're going to talk a bit about the recruitment and retention plan moving forward in what we call our new normal. So that's the objective for today. I want to take a minute and just provide some context around who we are within the Department of Health and Wellness. The Recruitment and Retention Secretariat is a small team that is mandated to fill what we call in high demand positions on behalf of the Health Authority, Health PEI. And we utilize proactive recruitment methods to engage potentially qualified candidates for nursing, physician, and allied health opportunities. So those are the areas that we recruit for. We also have a mandate that involves health demographics, health workforce planning, which we use data to inform the way we structure and deliver programs within the department and on behalf of the Health Authority. We use this evidence to, as I mentioned, create programs, but also ensure that what PEI is offering from a recruitment incentive package stance, or in terms of how we position Health PEI as an attractive employer, is based on solid evidence. Health PEI, as we know, is our one island health authority, and it is responsible for the delivery of publicly funded health services in Prince Edward Island. It obviously operates our hospitals, health centers, home care services, mental health and addictions, as well as our long-term care facilities. And as of today, Health PEI employs about 6,400 staff members, and that does include permanent, temporary, and casual staff. So it is a large organization. I wanted to talk a bit about the recruitment and retention pathway. I would in my role, I get a lot of questions around how do you do your work, or what elements are involved in the recruitment work that you do. And so when we think about recruitment and retention, we obviously think about the first step is recruiting talent, sourcing qualified individuals to fulfill the vacancies within our health authority. But that involves much more than just attracting them to a position. You have to ensure that we connect them to their peers within their profession so that they have the opportunity to communicate with others in that field around what it's like to live and work in PEI. It's a lot around personal and professional fit. A physician will not be interested in a position just because of its location itself. A lot of it involves what attracts that individual to the location, the community around it, what supports are in place for their spouse and their families. And that brings us into the introducing family support. When we do our recruitment work, we really think about it from the lens of retention starts on day one of recruitment. We recruit the right fit of the person, the qualified physician or the health practitioner, so that they stay and live and are content in Prince Edward Island. That also involves connecting them into their communities, whether it's in schools, community groups, choirs, cultural activities, whatever it is that they're interested in, we ensure that those connections are also in place. Providing mentorship and support, research indicates that in order for any retention to occur, you need to ensure that these health professionals feel supported in their work and that they're set up for success. And so those mentorship and supports are integral as part of those first steps in the recruitment and retention process. And then maintaining regular connection. Once we have a health practitioner who's agreed to come work in PEI, our work is not done. In fact, it's really just beginning. And that's when both our team and Health PEI ensure that that individual has regular connections, whether it's through the community, our teams, the facilities in which they work, other health professionals in that area, to ensure that there's really a nice wraparound feeling for those people who come in and start working in PEI. When we think about recruitment strategies, prior to COVID-19, I would say that the recruitment and retention team had very aggressive tactics or very aggressive efforts. We did a lot of travel. We did a lot of in-person attendance at various conferences for numerous health professions. We also traveled to meet with medical students or students of any other profession, nursing, physiotherapy, occupational therapy. We would meet with them in person and present opportunities in PEI, what it was like to live and work in PEI, information around incentives and structures, and answer any questions they might have about why they would want to consider Prince Edward Island as a destination to live and work. As I mentioned, it did involve quite a bit of travel, both nationally and internationally. And we always relied on social media as another way to promote vacancies. When we couldn't travel, we often had a social media presence, whether it be through Facebook, Twitter, YouTube, Instagram. We use a number of different avenues for promoting opportunities in Prince Edward Island. What happened during the pandemic, very quickly, as we all recall, is travel was no longer an option, and we very quickly had to adapt to a new way of recruiting. And we did this in a very purposeful and mindful approach because the whole country, the whole world was responding to a global pandemic. And Prince Edward Island was very mindful that we didn't want to be seen as trying to aggressively recruit health professions from another jurisdiction, knowing that they were also trying to respond and support the residents of their provinces. And so we did that. We kind of scaled back our approach. It was still available for those professionals looking for opportunities. They would find Prince Edward Island, but we didn't do it in such an aggressive, in-your-face way that we have normally done it in the past. We increased our social media presence tenfold. We increased our advertising for whether it be association websites or various medical or health professional websites that exist. We ensured that if somebody was seeking opportunity, Prince Edward Island was there for them to learn more about. And that speaks to some of the broadening we did around job ad placement. Search engine optimization is a tool that we have used, but again, we enhanced it. And what that really means is if somebody was searching physician jobs Canada or physician jobs in Canada, or many other search functions, Prince Edward Island would have been one of the top search functions that came up in their search, which just meant we were better placed and better positioned for somebody who was seeking opportunity. We also moved very quickly into online presentations. So my entire team is very comfortable using Zoom and WebEx and Google Teams and you name it. We often now have an online presence and are connecting with our students in a virtual platform, which I will say the students were very comfortable adapting to. Every educational institution went that way as well. And so now when we do our reach outs to meet with students, it's very normal that we would have an online presentation via one of those platforms. Students still have the opportunity to ask questions. We share the information in advance. It's still been a very nice way to connect with individuals, even though we're no longer able to be face-to-face. We've also seen conferences, some of these national conferences that have been in existence for years have moved to an online exhibit hall. And so what that means is Prince Edward Island has the opportunity to exhibit its opportunities, incentives and vacancies, but we do it in a virtual manner. And so we've become very adept at creating, using branding and marketing tools to create a presence for what it is to live and work in PEI. It's evolving, I will say that, and every conference that we're being invited to is looking at doing it a little bit differently each time. We're learning as we go, but it is something that we are absolutely seeing as the new way forward in terms of having a presence at those conferences. And at the conferences, I just want to make mention, it's not just practicing, current practicing health professionals there. Oftentimes you'll meet students, you'll meet residents, you'll meet people who aren't even in the profession but have just an interest in it. And it's a great way to make connections. And I often say in the recruitment world, it's not a short game, it's a long game. You have to start by building these connections with people early on and maintaining those relationships often for years. And so having presence at these conferences is one component of that long game where we need to be seen and people need to know PEI is interested in them. We've also engaged more private recruitment firms. We've always had some contracts with private recruitment firms. These are firms that have a standalone recruitment practice. They have clients who are seeking job opportunities, and for a fee, they will share their client names and contact information with us, and we will still determine whether or not that individual is a fit for Health PEI. We've always done it, like I said, but we've enhanced and perhaps engaged further some of those recruitment firms, knowing we didn't have the same ability we had in the past to really reach out to some of our health professionals. Oops, sorry. I would say when we talk about our new normal, the Recruitment and Retention Secretariat now uses what we call an aggressive virtual approach. We are very much, again, mainstream, wanting people to know about opportunities that exist in PEI. PEI is very unique. We have a lot to offer here, and I'm not saying this to a group that doesn't already know that, but we really have come through this pandemic with a heightened interest. People are looking at PEI now that potentially never considered PEI before. And so what we're using is technology and social media to a heightened degree to ensure that our opportunities are well positioned and that, like I said, if somebody's looking for opportunities to work, they will know PEI is an option for them. We talk a lot in our recruitment world about what it's like to live and work in PEI. Work-life balance is important for our especially our graduating health practitioners, but certainly for the current practicing health practitioners. A lot of people have potentially worked in an area. It's been very busy, and they're looking to transition into a practice or into a lifestyle that's more conducive to where they're at in their life. And so PEI has been for us a very solid offering in that regard. And that's, I guess, the last point there, responsiveness to increased interest, not just from Canadian health professionals, but from international health professionals as well. And we are working with our Office of Immigration around some of the delays we're seeing in immigration right now. It doesn't prevent us from doing the recruitment work. We just have to be mindful of what those immigration rules and timelines are so that we can communicate it effectively with our potential recruits. In terms of challenges in recruitment, I would be remiss to sit here and say we don't have any. There are a few. Certainly the travel restrictions, that has been a complete shift in how we've recruited in the past. But I will say that we've been able to adapt in a way that still allows us to connect with interested individuals. We used to offer site visits. If we were recruiting a physician, at a certain point in the selection process, we would offer them an opportunity to come with their families and visit Prince Edward Island and really get a sense for what it would be like to live and work here. Under the new COVID restrictions for travel, that obviously hasn't been an option. We have done some innovative, I would say, shortened site visits where we actually have had some of these health professionals come to do locum work or short-term work in some of our facilities. And when they're not working, they are in isolation. But it still allowed them to come and meet some of their colleagues, even with their own eyes, see Prince Edward Island, even though we couldn't organize potential meetings with realtors or school boards or whatever it might have been that we've done in the past. But we've still been able to have some individuals come and experience PEI to a certain extent, which has been beneficial. We've also seen a number of health professionals indicate their inability to leave their current practice or their province or their country because of their need to respond to COVID-19. Prince Edward Island is not alone in some of its shortages for healthcare workers. We are seeing it as a national shortage right across the country, and we are very mindful that an anaesthetist who's responding to COVID in Alberta might not have the same flexibility or availability to come for a site visit or to come and experience what it is to work and live in PEI. So we have had that feedback. I would also say the limited face-to-face connections has been a challenge. Oftentimes, when you meet people face-to-face, there's a bit of a rapport and a trust that's established, and that goes a long way in our work in recruitment. We spend a lot of time getting to know these people, often getting to know their families, really understanding what it is that they would like to see if they were to come and work in PEI. And without that face-to-face connection, it's not that opportunity doesn't still exist. It just takes a little bit more time, and it potentially could not be as, we might not have as quick of an ability to have those connections to strengthen the recruitment effort. So that's something else we've noticed. And in terms of labor supply shortages, that has been, it was before the pandemic, and it continues to be a challenge in recruitment. Nursing, for instance, we have a number of vacancies in PEI right across the system, public and private. And there aren't enough nurses coming out of our systems to meet the demands of our health system. We know that. And so we are looking at innovative ways within the department, partnering with Health PEI and our private facilities to try to attract more or enhance the labor supply and attract more people to come work in health professions. We need to do that as a province, and I would say right across the country, other provinces are also looking at those innovative ways. When we talk about some of the recruitment and retention programs that existed, I just wanted to give you folks a high-level review. We have always had return in service incentives. Those are financial incentives that we provide to some health professionals in exchange for a commitment to work in Prince Edward Island for a period of time. So for instance, if you were a family medicine practitioner who wanted to go work in Tignish right now, you would be eligible to receive a financial incentive of up to $90,000 in exchange for a 5-year return in service commitment. So those incentives are in place, and we do promote them, and they are a big piece of the way we do recruitment, but research would indicate financial incentives are not the main reason why individuals choose to come and practice in a certain location, especially a rural location. It is about more of the organizational fit, the organizational culture, the community, the supports that they receive, their feeling of recognition and value. Some of those higher pieces that we also as a system recognize and are striving to implement. The Family Medicine Sponsorship Program is a program that has been in existence since 2014, and what that is it's an incentive that's provided to medical students while they're still in training, with the same understanding that once they complete their residency training, they will come and work with Health PEI for a certain period of time. We have 3 Family Med sponsored students currently practicing in PEI, and we have 2 more who will likely be receiving letters of offer in the next few weeks, which is very exciting. Some of them are from PEI and wanted to come home, some of them aren't, and we've been able to attract them and retain them because of that program. We also offer moving reimbursement incentives, which is pretty straightforward. We offer receipt-based incentives for individuals to cover the cost of their move to PEI. And the amount of that incentive varies depending on where they're traveling from. or moving from. We also talk a lot about our collaborative networks and our collegial working relationships. The work that we do every day in recruitment and retention, we do not do it in a standalone manner. We rely heavily on our partners with Health PEI and heavily on our partners in the communities. When we have an individual who's interested in coming to visit PEI, it's not my team who knows the areas of PEI the best, it's the individuals in those communities who do. And we want them to share that information and really promote and highlight the best of what it is to live and work in PEI. And so for us to do our work effectively, those collaborative networks and relationships are paramount, and we work really hard to maintain them. When we talk about nursing, under this government, we did have a new nursing recruitment incentive program for graduate RNs. It was announced in November of 2018, but it was updated last year with enhanced incentives for graduate RNs. We also incentivize graduate NPs, nurse practitioners, experienced RNs, and experienced NPs. So that program has been in existence for just about 2 years, and it has absolutely positively impacted our ability to recruit nurses to Prince Edward Island. We've also seen Health PEI respond by implementing what we call our Transition to Practice program. And that is a program that Health PEI provides new graduate RNs to come and work in the system, and they provide them mentorship and support above and beyond the orientation period that they receive. It's really about setting up our new graduate nurses for success. It's born out of research, and it is absolutely, when we do our recruitment work, this is one of the programs we speak of most, because not every jurisdiction in Canada offers this type of support to its new graduates, and we are very proud of Health PEI's work and commitment to that program. When we talk about allied health professionals, as I mentioned earlier, this could be physiotherapists, social work, psychologists. Those are some of the areas we're seeing pressure on right now. We are in the process of establishing what will be an allied health incentive program. And this is really another incentive program that we can use to entice qualified allied health professionals to come work in our province. I thought it would be important to talk about some of the strategic partnerships that exist in order for recruitment and retention to be successful in Prince Edward Island. We've worked very closely with the College of Physicians and Surgeons in Prince Edward Island to streamline the international medical graduate licensing process. And for those of you who don't speak this language every day, what that means is any internationally medical trained physician who wants to work in PEI, the college is now heavily involved with the licensure process earlier in the phase of the recruitment process than they had been in the past. And that's really positive for our team. It allows the regulator to come in earlier and determine whether an IMG would be qualified to obtain a license in Prince Edward Island, which then allows my team to more effectively recruit them. And so we're really pleased with that. The Physicians Recruiting Physicians program with the Medical Society of Prince Edward Island, you've no doubt heard of that program. We are working through the last stages of the contract negotiations in that program, and we are hoping to implement in the coming months. We're very excited. We see that as a positive. It's a new innovative approach to recruiting physicians that doesn't exist anywhere else in Canada, and we are happy to be one of the 3 partners between the Medical Society, the department, and Health PEI. And we've also, through the pandemic, seen an increased, heightened, awareness around the collaboration with some of our private long-term care and community care facilities. The department has been very eager to provide what support it could to some of those private facilities who also experienced staffing shortages through the pandemic. And so that work is ongoing. There's been task groups established, and we're seeing some really great collaboration between the health authority and these private facilities, as well as the department. What success looks like for us. I get this question a lot. People often ask me, how many physicians did you recruit, or how many nurses did you recruit? And while we all know it's so much more than just the numbers, I wanted to show you the numbers because I do think it matters. Currently, to date in 2020, we have had 19 new physicians sign on to practice in PEI. And I want to note that at this point in this year, that is a higher number than we saw in all of 2019 and all of 2018. So we are on track to recruit more physicians this year than in the last 2 years, which is a very positive step forward for Prince Edward Island. As I mentioned earlier, we have 2 Family Med sponsored residents who will be placed within the healthcare system in the coming months. And we also have long-term locum programs with attractive incentives as a way to entice more physicians to come try PEI. Locum opportunities are absolutely a recruitment tool. It's a way for somebody to come and experience working in Prince Edward Island, and often after they've experienced it, they will choose to stay, or at least come back, which is a positive. When we talk about nursing, through the Nursing Recruitment Incentive Program, just this year alone, we've hired 76 graduate RNs into the public health system. We've hired 3 experienced RNs, and we've hired 4 graduate NPs and 2 experienced NPs. We've also hired 78 nursing students this summer. That was part of the response to COVID-19. Traditionally, we've never hired that many student nurses, but this year, recognizing student nurses played such a vital role in providing support to the healthcare system, we hired as many of them as we could, and we actually had Treasury Board approval to increase the rates of pay this spring, which also allowed us to recruit more student nurses. So we're very proud of that. In terms of allied health, our psychologist vacancies in Prince Edward Island dropped from a 40% vacancy rate in 2019 to a 25% vacancy rate in 2020. We still have a ways to go. We still need psychologists, but it is showing a trend in the positive direction. And we also hired 26 Healthcare Futures students this summer. Healthcare Futures Students is a program that's been in existence for a number of years, and it, again, is a recruitment program. We often see those students who've come through that program come back into our health system later in life once they've completed a health professional program. So we are very pleased to see that program continue and have success. In terms of this government's commitment to recruitment and retention, I wanted to speak to some specific, tangible actions that have occurred recently, which we see as a positive. This government has increased psychiatry and orthopedic surgery complement, which is now funded. It's increased the specialty positions in nephrology, urology, cardiology, and rheumatology, 3 of those which we've already filled. Nursing Recruitment Incentive Program, I did mention the increased incentive, which occurred in December of 2019. That has absolutely been a positive. Prior to that increase in the incentive, we had recruited 35 graduate nurses under that program. Since that time, as I mentioned earlier, there were 74 graduate nurses recruited. So we're really pleased about that. The RN Bridging Program has seen 10 graduates just this spring. Was it this spring? Just recently, in the recent months, 10 graduates coming from that program. And that's a huge success for Health PEI's system. Our partner in the department, Roseanne McQuaid, has been leading that work, and it really has allowed nurses who have potentially trained in other parts of the world, or nurses who potentially haven't practiced nursing in a number of years, to come back and get retrained and re-enter the workforce. That's a very positive program, and we're excited to see it continue this fall. The Physician Master Agreement funding has also been put in place to develop a healthy physician workforce program. And we know when we talk about retention, we need to focus on the health of our staff, and this program will work towards providing better supports for our physician health workforce. We've also seen this government committing opportunities for innovative workforce development practices. Looking at some of these challenges and looking at innovative ways to address them, we're really excited about some of that work moving forward as well. When we think about recruiting for tomorrow and what we need to do, there's lots of work to do. We are looking at the development of a comprehensive physician resource plan or strategy, which will help predict the future needs for Prince Edward Island. So we know what the current complement looks like today, but what we don't know is how many physicians are we going to need in PEI in the next 5 years. And this resource plan and strategy will provide us that guidance. It will strengthen our ability to recruit because we will be doing it in a more proactive manner, and we're hoping that it'll be a positive outcome for the health system in general. When I mentioned our team earlier, the Health Recruitment and Retention Secretariat also has a mandate to provide health workforce planning and data. We have started creating 5-year proactive recruitment models, which are based on predictive analysis. We look at the data that currently exists about our health workforce demographics. We project certain retirement dates. We make reasonable assumptions. We factor in national data that can also inform what we're seeing in Prince Edward Island. We We look at turnover, historical practitioner turnover, and we look at population health statistics and growth. All of those elements allow us to reasonably determine what the needs of certain professions are going to be moving forward. We're also looking at creating more flexible succession planning and practice transition systems with our current physicians, which will really just allow the new physicians coming into our system to be better supported, as well as the physicians who are retiring from our system to feel that they have the time and the supports they need to transition out of their practice, making sure their patients receive the care they deserve. I think that's it.
Great.
Thank you very much.
Thank you. Thanks very much for the presentation. We'll open it up for questions. We'll start with Trish.
Thank you, Chair, and thank you so much for that presentation. I do have a few questions. I'm wondering, you mentioned the 5-year physician planning strategy. Do you have a sense then of how many physicians are likely to retire in the next 5 years?
I don't want to quote the inaccurate data, but the Medical Society of Prince Edward Island had done a survey about a year ago, and I think they identified a third of their physician workforce were going to be leaving Prince Edward Island, leaving the workforce in the next 5 years. So that's the number, Trish, that we've been kind of working on. But as it exists today, without that plan in place, physicians will often provide some level of advance notice of their plans to retire, and our team will start the recruitment efforts immediately once we have that written notification. But it does vary. So we've seen that notice come from 4 weeks in advance, anywhere to 2 years in advance.
Trish?
Okay, thank you, Chair. I'm also wondering about the changes that might have occurred, in interest due to the Atlantic bubble. I mean, that's just something I'm hearing anecdotally, that, more and more people are interested in, PEI in Atlantic Canada because we have, been so successful with, COVID-19. Is that something that you're hearing as well? Yeah.
Absolutely.
Okay.
We've seen health professionals who potentially have never worked in PEI step forward and express interest in either coming as a physician, they could come as a locum, or even offering short-term work in other professions. So that has been a positive for our recruitment work. We've been pleasantly surprised to see that interest heightened during the pandemic.
Trish?
And you had also mentioned that there's been some work with the College of Physicians and Surgeons to break down some of the barriers or to make it easier for international recruitment for that transition, I guess. Are there still barriers that exist, and what might those be?
I'm not sure I'm the most qualified person to answer that question, Trish, but I'll tell you what I know. In Prince Edward Island, the College of Physicians and Surgeons is the regulator, and they determine which physicians receive what level of license. And so my team, the team in the department, we work closely with the college, but we don't influence the college. They are, at the end of the day, the determining factor. What I would say is, as an international medical graduate, depending on if you're a family medicine physician or a specialist physician, there's different requirements. Whether you have certain Canadian exams completed or whether you have Royal College exams or eligibility. And they also look at factors whether or not you've had any independent work experience in Canada. And so every physician's resume is different, every situation is different, and the college looks at them that way. They will consider the individual's training, where they trained, where they've done residency, where they've done fellowships, what work experience they've had. All of these pieces come together, and the college will make a determination on what level of license they're able to provide. The health system then needs to make a decision of whether or not they can support that level of license. And when I say level of license, I mean there could be a supervisory requirement for a period of time. So that physician could be licensed, but might not be able to work independently for, say, 6 months. And depending on the health system and where they're interested in working, we work very closely with the college to determine, and with Health PEI, to determine if it would be a fit based on the license that they'd be issued.
Thank you.
Trish?
I do have a few more questions. They're kind of all over the map. They're not all a nice, transition from one to another. So I apologize for that.
No worries.
In advance. We're going to be jumping a bit. You mentioned the success of the RN bridging program, and that's really interesting to hear. so that's specifically for supporting, from what I understand from your presentation, RNs who might have their training outside of Canada or who haven't worked for a while. What are your thoughts on an RN, an LPN to RN bridging program, and what opportunities that might open up?
So I understand your question properly. Do you mean LPNs who are currently practicing and are looking to obtain their RN credentials?
Yes,
Okay.
So that's something that I've heard a lot of interest in from LPNs, and I'm wondering if that's something that has ever been explored. Perhaps, I don't know if this bridging program could be expanded or built upon to allow our LPNs and PEI the opportunity to train in a shorter period of time to upgrade their skills.
Yeah, we've heard that too, Trish. We've had the minister and I have actually had meetings with some LPNs in Prince Edward Island looking to go further and receive their RN training. As you know, the registered nursing programs are very competitive, and there aren't as many seats in them as potentially the demand for those seats exists. So what we would say, or what I would think in the department, is we would absolutely love to see some of those programs exist, because we know there are good LPNs currently employed in Prince Edward Island who want to train further and become an RN, and our system needs them. There are a lot of LPNs who are looking to take that training outside of Prince Edward Island at other educational institutions. And I know that Health PEI is working closely, as well as the department, are very connected to the University of Prince Edward Island. And they do meet on a regular basis to discuss the way the nursing program is structured and how LPNs can probably have or potentially have pathways into their program. So it is a conversation we are aware of, and we're very interested in continuing it, because it does serve to strengthen our health workforce overall.
Yeah.
Trish?
Thank you, Chair, and I'm glad to hear that those discussions are happening. I think as well, from what I've heard, that interest in getting into the field, getting your foot in the door, training as an LPN would be increased as well if people knew that they had that opportunity to upgrade a little bit more easily in the future should they choose to do so. So I do hope that there's progress made there. I'm wondering about exit interviews for those who do choose to leave Prince Edward Island. Do we currently conduct exit interviews to learn why they're choosing to leave and hopefully avoid that in the future with other professionals?
Sure. So we actually do two types of interviews. We do what we call stay interviews, and then there's the exit interview you're referencing. A stay interview is a more proactive method where an employer meets with its employee while they're still employed and asks them questions around what's working well and what do you need support on. Our team does stay interviews with our physician workforce and our nurse practitioner workforce. Health PEI does exit interviews with the remainder of its staff, but that would be outside of my team's jurisdiction, so it would be with the health authority.
Trish?
And so,
Oh, go ahead. Jump in real quickly. I did check on that actually before we were coming. It is with Health PEI, so I was told that the exit interviews are happening. If you are exiting the system, you will have an exit interview, but they'll also focus, I think, if they see high turnover in a certain area, they may also choose to do exit interviews there as well.
okay.
Trish?
And so, so the interviews that are done through Health PEI, that information is currently not shared with you at all, or it just feels like that would be useful for you to know what?
Yeah, it
what's
would be
happening.
useful information, and certainly we had discussions, to be honest, before COVID. I had reached out to have a discussion on, on that interview, or on the information that was being collected. So I had followed up on that, and I think we'll look further into how that might work. Yeah.
And
Trish?
can I go more? Okay. And overall, how much of your time and resources are spent on recruitment and retention for different health professionals? So we've spoken a lot about physicians. I've heard about RNs and nurse practitioners. Not quite as much about LPNs. I'm just wondering where, how is that time divided?
So the way the Secretariat's currently structured, we have one dedicated resource that focuses on physician recruitment for both family med and all specialty areas. And then we have one resource that focuses on the nursing and allied health files. And when we think about allied health, where the pressure points are, I mentioned earlier, social work and psychology are two that pop up right away, but it varies. And so we are constantly monitoring the data, the vacancy data that exists with Health PEI, to know where we're seeing turnover numbers and where we might need to be turning our attention to support recruitment efforts. When it comes to LPNs, we consider them under our nursing file. So when I say physicians, nurses, I mean nurse practitioners, registered nurses, and LPNs, and then our allied health professionals. So I do have an individual who would be dedicated, and through COVID, it's funny, we had a few LPNs just raise their hand and say, I've never been to PEI before, but I'm interested in coming. And we work with them to ensure they can get registered with the LPN college here in PEI, as well as so that they know where to go to apply for positions with Jobs PEI. So, and we've seen some of them convert. So that would be our term to say an individual's express interest. We've provided them with the information, they apply, and they've been hired through the health authority. So.
Can I just have one more?
One more question.
Thanks. No, that's great to hear. And, I was also pleased to hear about the moving reimbursement for physicians. I think that seems like such a small piece, but when you're trying to go through the challenging process of moving from one province or even one country to another, I don't know if it's just within Canada that move is.
Internationally as well.
I think that's great to hear. I wonder if there's been consideration to expand that for RNs and nurse practitioners who are also moving, because right now that's not offered, right?
Well, actually, Treasury Board has a policy for reimbursement of moving allowance. And so as a nurse or any other health practitioner who's considering moving to Prince Edward Island, it's a discussion that they could have with the hiring manager, and it does depend on budget appropriations. But our team would communicate to anyone interested in working in PEI and potentially relocating to PEI that if you're looking for relocation assistance, you should speak to the hiring manager and then with the Public Service Commission through the hiring process. And they can refer to the Treasury Board policy, which, like I said, does provide that as an option.
Okay. Thank you.
Great. We'll come back to you, Trish. Hannah?
Thank you, Chair. Can I go back to allied health professionals? What's the scope of, what range of professions does that include under your kind of mandate?
We always, we define them as in high demand, Hannah, so, or what used to be called hard to recruit, but we've kind of tried to focus it a little bit more on the positive to say they're in high demand, and they do shift. So a few years ago, medical lab techs were in high demand, and they were what we would consider an area of focus for us. But through aggressive recruitment tactics and support programs, seat purchase programs, things like that, we've been able to stabilize that workforce for the time being. And I say that because I could walk out that door and that could change. Yeah. But for now, we feel that there's been adequate resources provided to support the need. But again, that changes on a daily basis. So today, when I think of in high demand allied health professionals, and again, this isn't me pulling this out of the thin air, this is based on data from vacancy reports that we run every month. We know that psychology, social work, and some of our occupational therapy positions are in high demand. So we have higher numbers of vacancies. I have a note here, I just brought it with me so I could refer to the most recent vacancy report that we had run. So nurses, the nurses in a different section, but psychologists, social worker, and currently physiotherapy assistants is another area where we're seeing a demand. We see positions coming up in the health system and we have some vacancies for it. So that would be another area where we turn our attention to. But it just depends on the day and it depends on the health system. We have very close connections with all the allied health groups across the health system, and they know to reach out when they should or when they have a need for support. We also work very closely with Health PEI's human resources team so that we can be a little bit more proactive and identify potential pressure points coming up in these areas in the future.
No, that's really, thank you, Chair. It's really helpful to sort of know that kind of responsiveness is there, and kind of, there's a couple of areas of pressure that are from programs that are kind of moved through from here that I'm wondering how that then impacts, into the space where you're. So one of those is the school wellbeing teams, which have been, hugely valuable and are currently, really essential because of the various pressures that we have. But I've heard anecdotally that there have been some challenges because it's brought some other pressures in terms of needing to, and I'm hearing that some of these spaces, like especially around social work and that kind of thing, or even occupational therapy piece, could be a apart. So has that had an impact in terms of that kind of dual pressure of space in the educational system and in the normal healthcare?
I haven't run a specific report that would tell me the vacancies in our health system due to individuals moving into different roles, specifically with the school wellbeing teams, but I'm hearing anecdotally as well that is a pressure point. And when we run our reports, we do have the ability to drill down and look at service level areas and see where the vacancies exist in each location. But I would say overall, when I look at the trend data for social work, over the last year, we've seen an average, kind of a consistent vacancy rate, and so we know we absolutely need to do more to recruit and retain social work. And we don't do that in isolation. We've had conversations with the Department of Social Development and Housing, because they're a large employer of social work as well, and Health PEI. And we do it, even though my mandate or our team's mandate is really about Health PEI, supporting their needs, we recognize those needs that exist in other government departments, and so we work together to try to address them. And we do things like the predictive analysis modeling that I spoke of earlier, engagement with social work programs, everything we can to ensure that if you're a social worker, you know that there's opportunities for you to work in PEI. So.
No.
Hannah,
Thank you, Chair, yeah, and I appreciate that. I know, like, the wellbeing teams have been up and running for a while now, but and as I said, that kind of essential nature so strengthened it in the current situation. But you know, the transitory nature of some of the work would make sense that we sort of see an impact somewhere, regardless of the original source of the hiring process. You know, on that same kind of vein, there's a couple of other programs that have been topics of discussion in this space, and I'm wondering whether they have yet showed up in your recruitment targets. And one of those is midwifery. And the other one is public dental service, and whether because that was actually something that for the first time we talked about sort of expanding that dental support for seniors and low-income islanders, but unfortunately we've not got that going yet. I'm wondering if that recruitment sits under your space, and also if midwifery does, and if so, sort of is that on your radar?
Do you want to speak on that? Okay, that's fine. So midwifery is actually an area that's been discussed for the last few years, but today I don't have the mandate to be recruiting for midwives. I do have, through my role, there's an Atlantic body that I'm connected with. It's the Atlantic Advisory Committee on Health Human Resources. And just as recently as last week, we were having discussion around midwifery in the Atlantic provinces and recognizing provinces are expanding that service. And so what are we going to be doing to respond in terms of a labor supply action? And there's discussions, early discussions around how we can look to do that. So they are regulated and in the other jurisdictions, and that's great. But as of today, it's not one of my in high demand areas that we're focusing on. Yeah.
Hannah?
Thank you. And then the other one, because that was that's okay. I tend to do that. Too many thoughts. Is public dental service under your mandate at all? And if not, where does that sit?
It's not under me. Lori, I'm not sure if we know where that sits today.
We can bring that back to you.
Sure.
Hannah?
I would really appreciate that. It's a pretty important commitment, and we had a financial commitment for it in the budget, but we're not sure where it's stuck. So it would be really helpful if we can kind of narrow that down a bit. And I appreciate it. It may not be in your box there, but if we could kind of get some direction, I would really appreciate that. Chair, if I just have one other question.
Sure, go ahead.
Really interesting to hear you speak about sort of how the return and service incentives are less of a draw for some, I think that was what I took away, was that they're still there, but they're not necessarily the only impactful way to sort of recruit and retain. When it comes to recruiting for rural healthcare, is it more about the story and the quality of life, the launchpad approach versus the return and service?
The way I always think about incentives, you have to have them to be competitive. We are constantly scanning other jurisdictions to see what they're doing in terms of recruitment tactics. And arguably right across the board, financial incentives are present. What we also do is look at research to say what's the efficacy of these incentive programs. And when it comes to rural placements, absolutely, I could sit here and say, yes, our financial incentives have been a benefit. And actually, when we went through in 2018, we actually restructured the family medicine incentive program for rural areas so that the rural areas actually received more of a financial benefit, financial incentive, than some of our more urban areas, because we knew that it is sometimes harder to attract an individual to work in a rural setting. But at the end of the day, the success we've had in recruiting to rural areas is when somebody has grown up in a rural area, they have connections to that rural area, that's the type of medicine that they want to practice, like in that type of environment. And they're seeing some of the really innovative and creative work around delivering health services in these rural areas, and they're attracted to that as well. So I think it has to be there, but there's so many more components to it. And when I said earlier, recruitment, retention starts on day one of recruitment, it really is a fit. It has to be a personal and professional fit for those individuals who are going to go into those rural areas. Otherwise, they won't stay. And we also know from research, the cost of recruitment is 3 times that of retention. So if we can retain them, we're far better off as a health system. Yeah.
Thank you.
No problem.
Thanks,
Jamie?
Thanks, Chair. Thanks very much for your information today. I just got one quick question. How much does the, when we're talking about recruiting a doctor, whether it be male or female, doesn't matter, or any healthcare provider that's coming into the province, how much lenses are looked at what's there for the other part of the family, the spouse, or the child, or?
That's a great question. So spousal support program is absolutely available for not just our physicians, for any of our health practitioners who are recruiting. And I would say it's very important because oftentimes we'll hear of a health practitioner who say, I want to come work in PEI, but my wife's a teacher, or my husband's an engineer, or we have a hobby farm, or whatever it might be, whatever their interests are. We have to work as a system to ensure that we're meeting the spouse's needs as well. And the children, we've had health practitioners come and children have special interest in sports, or they have special needs, or they have musical interests that they want to ensure whatever school system they're in, they have the right programs available to them. So those are all very crucial elements in the recruitment process. And when I mentioned earlier about the face-to-face connections that we establish with our recruits, those are the conversations I'm referencing. It's really getting to know them as a person, who they are, who their families are, what is it about them that would make them want to come and practice in PEI. And that's the information we bring into how we proceed through the recruitment process when we consider them for different opportunities. At the end of the day, as much as my goal is to recruit and retain as many health practitioners as possible, we want to make sure it's the right ones, and we want to make sure it's a fit so that they stay, because that provides continuity of care to the health system, and that's really what's important. So,
Jamie?
So how close are we working then with, if we have that scenario where one is the doctor and one is an educator, are we working with the Department of Education to come up with that fit? Or it could be something else too, but are we doing them cross-department, having them conversations?
we absolutely are. And we also have conversations with the public schools branch or the French language school board, depending on the language preferences. We also work very closely with the human resources teams through the civil service and Health PEI. So we rely on those networks, those professionals who know about vacancies that exist in the system, and we create, oftentimes it's just about creating links. It's about building a network, starting a conversation so that that individual can put forward their resume, their qualifications, and express their interest, and then they still need to be considered through the right process for being considered for positions. So we don't influence that. We just create the links. We kind of open the door when we can. There's been times where we've recruited health practitioners, and we've offered the spousal employment support, and the spouse has already secured an opportunity, or already has networks, or is working virtually and doesn't need necessarily, can move to PEI and continue their work from wherever they were coming from. So that's been a new development, I would say, through COVID as well.
Jamie?
Thank you. Final question. Is there one thing that stands out if we've got 2 or 3 doctors, doesn't matter, whatever, one doctor wants to come PEI, then at the last second says, you know what, no, we're not coming. Is there one thing that stands out that's sort of consistent with other medical professional people that aren't coming?
One thing that stands out as to why they choose not to come to PEI, is that what you mean? I'm thinking of some of the most recent recruits that have chosen not to come to PEI. We've gotten to a certain step in the recruitment process. Oftentimes, if I had to summarize it, it would be personal choice. Family ties are really important to people, and we've had individuals express interest, go through an interview, provide references, come for a site visit, and at the end of the day, a family member of theirs got sick and they decided, you know what, the timing's not right, I'm going to stay where I'm at. I've seen other individuals express interest around, I'd love to come to PEI, but I need to wait for my youngest one to finish school, right? Or certain links that are ties or connections that they have within where they're currently working that just don't allow them to pick up and move as quick as they would like. And I'd have to think that's no different than any other professional considering a move as well, but we often would ask that question. So if we've gotten to a point where an individual has said, thank you, but I'm not able to come, as the manager of the Recruitment and Retention Secretariat, I would, in an appropriate amount of time, reach back to that individual and just say, you know, I understand, I appreciate your decision. Could you just help us understand, like, what was the recruitment process like? And was there anything we could have done differently to change your mind? And because I want to know, we want to know that information so that we can improve moving forward. And the responses I've gotten when I've asked that question have all been around personal fit, just personal connections, timing wasn't the right move. It's never about financial incentives. It's never about, you know, Prince Edward Island, they love what they see when they get here. Like, it's not a hard sell. People love it, but it's often that timing to be able to pick up and move. So, yeah, no problem.
Heath?
Yeah, just so what is the average from the time the initial contact to a physician and the time they actually arrive on PEI? Like, how long does that process take?
It varies. I know that's not the answer you're looking for, but it does vary. We've had physicians we've been recruiting for years, from the time they're in medical school, through their residency, and then even after that, they've started practice somewhere else, and then they've indicated interest in PEI. But from the time a physician applies to a vacancy, because they do have to apply, once they've applied, there's a fairly quick turnaround in terms of receiving their license, being interviewed, providing references, the site visit offering that we talked about earlier, and then it really comes down to when they would be available to wrap up their practice in their current location and relocate to Prince Edward Island. So we've seen it happen as quick as 3 months. It can take as long as 2 years. It just depends on the individual.
Heath?
Just so, you know, the Joe public out there saying there's close to 14,000 people in the registry, but we're seeing the numbers grow as far as number of physicians coming into the province. What's your response to that, for us to respond to them?
Sure. We've kind of changed our mentality around a retiring physician leaves and one physician comes in to replace them. That's not the way it really works anymore. Some of these retiring physicians have practices that are quite large, and it actually would take 2, if not 3, new physicians to come in and take over the size of that practice. So when we see a physician retiring, that's our first question: how big is their practice? Because we know then, you know, how many, what the needs, I guess, what some of the demands are going to be to have a new individual coming in to try to take that over, or to come into that network or the area, wherever it might be, and provide the level of service that's required. So it is challenging, and it's, I've seen in other jurisdictions, they've adopted models where it's kind of a 1 out, 2 in model, so they automatically know when a physician retires, it's going to take 2 to replace them. We don't necessarily have that model in PEI, but we do know oftentimes when a physician's leaving, the expectation, it's unreasonable to expect a new graduate resident to come in and take over a practice that size. We would never do that. Health PEI would never put them in that position. It just doesn't set them up for success.
Yeah, maybe I'll just jump in for a second. Oh, yes. Yeah. So to your question, I think we have to, in terms of responding to the public, I think we have to be innovative, and I think we have to look at different things. So I was just on the phone this morning with medical affairs talking about for the unaffiliated patients using a Zoom process where we're actually sending out letters of invitation to patients that they can register and get treatment through Zoom. So yet it's another way of trying to be able to connect with patients in a different way to help, with those issues. So again, I would say I think it's trying to be innovative and to come up or look at the issues with new lenses as to how we might be able to solve that. And COVID, I think, has been a real gift to us in that it has challenged us to, to take the challenges and to look at solving them differently than we have in the past. So I think that's a mindset and a culture that we need to grow, and I think we're seeing that now in the work that we're doing. So I don't know if that helps in responding to the Joe Q public, but
That's fine.
yeah.
Just in saying that, in that discussion, we've had the Pharmacy Association come in, and they're always willing to do more. Has there been any discussions relevant to the Pharmacy Association actually doing more on behalf of the medical society or whoever?
Yes, yeah, there have been. Yeah, I've had numerous discussions with Aaron, yeah, as well. Yeah.
And I noticed on your, when you were doing your, I'll call it marketing, I don't know what you refer to it to as when you're actually marketing Prince Edward Island to do, to secure some physicians. Has there been anything done with virtual reality as far as using virtual reality to entice physicians to come to Prince Edward Island?
So your question is very timely because as I mentioned earlier, some of our challenges are around the inability to provide that site visit experience that we've done in the past. And so our team is looking at doing, whether it's virtual reality or virtual site visits with a GoPro camera, but really giving the individual the opportunity to experience PEI without actually being here. And so we are looking at exploring those options because more and more physicians and other health practitioners are asking, I'd like to come to PEI, I'd like to see it before I commit. And so we're trying to provide what we can, working with our partners in tourism to really identify the best of what PEI has to offer and our partners with Health PEI too, so that we can do those types of virtual or video type options for site visits.
Heath?
That's good to hear because we were just talking about the seafood industry and what they're doing, virtual reality plus the aerospace and all these other ones, so it would be worthwhile. Just on you talked a little bit about psychology and the demand that's on psychology, but I just want to get your clarification. Is the demand on accessing psychologists, or is the demand, you're seeing a major demand in the mental health?
So the demand I was speaking of was about our vacancies. We run reports every month, and psychology is an area in our healthcare system where we have more vacancies than we'd like to see. And so it's a pressure point for us, and we're trying to recruit to it, trying to bring in new. We have had success recently. That's why I mentioned the vacancy percentage has dropped from 40% to 27%, but we still need to fill some vacancies. So we are aggressively working on that right now.
Okay. Trish?
Great, thank you, Chair. I want to just touch on something that you just mentioned that I really appreciated. So the language that you used when talking about new doctors coming in and not taking on a full practice, but that doctors today, many new doctors would not be taking as large of a practice, and we know that that's because doctors are concerned about their own health and wellness and their families, and that's a good thing. We want our doctors to be healthy, well, and strong themselves, so they're able to practice to their full potential. And the language that you just used was that, if I heard you correctly, was that it's unreasonable to expect anything else. And I think that's a really important way to frame it. So as recruitment and retention experts are well aware of the importance of language. And when we are thinking about how people are making those initial sort of decisions over which places they might be considering, you mentioned the importance of online searches. So when I'm thinking about if I'm a new doctor kind of considering different areas, sure, I'm gonna do an online search, but then I'm gonna Google search news stories about physicians and what's being said about doctors in the community by leadership and by to be perfectly honest, by the Minister of Health. So I think we need to, this is not your responsibility, but I just want to state this for the record, but I think that the language you're using is really important, and I would encourage all of us, particularly the leadership in our government, to think about that, because when we're framing it as a problem, that, you know, doctors today don't want to take on as many patients, this is a problem, that they won't do it. I think that's a very negative tone, and I think if I were a doctor looking at that, I might think, do I want to come to a province where, you know, the minister thinks my priorities and needs are a problem, or do I want to be somewhere where they recognize that this is an important part of my life and that I need to be able to be healthy and well where I'm living? So that wasn't a question for you, but I just wanted to say that the way that you frame that language, I think, is important, and I just wanted to acknowledge that. The Canadian Federation of Medical Students released a report recently around recruitment and retention, and they had some recommendations. So one of those recommendations was around continuing medical education. And can you tell us a little bit about what professional development opportunities are offered for healthcare professionals to help retain them?
So for physicians, if they're a salaried physician, if they choose a salaried payment modality, and they're a family medicine physician, they're eligible for $5,000 for Canadian medical education training each year, plus the time to take the training. If they're specialist physician, they're eligible for, I believe it's $7,000 under the master agreement. I'd have to confirm that, Trish, but it's a little bit more, and same idea, they're provided the time to take that training. In other professions, the union collective agreement would have provisions for professional development, as well as the province of Prince Edward Island through the Public Service Commission. There's access to unionized development training funds, and so individuals have access to not only the time to take professional development, but some of the resources required for them as well.
And is there pretty good uptake on those types of opportunities?
I can't speak for the Public Service Commission's programs, but I do know there's been times where individuals have applied and have been denied because the funding has been exhausted. So that would tell me that, yes, there's good uptake there. With CME, I wouldn't have that information because it would be approved through Health PEI. So it would have to be something we could find out and take back to you.
Great, thank you. And just building off of Minister Fox's question, regarding the Transition to Practice program and supporting newly recruited staff at all levels, I guess, you know, to be connected to their communities and have their, you know, be supported throughout that process. Do you do any sort of an evaluation or receive, do like a survey or feedback, accept feedback throughout that process so we can improve? On how we're doing that?
So that the Transition to Practice program is a program that Health PEI administers, and I don't want to speak on their behalf, but I would assume that they'll be doing an evaluation of that program. It just was implemented in January of 2020, so it's fairly new in its inception, but I've heard good feedback so far, and as I mentioned, it's one of those key recruitment tools that we speak of in our work. We really promote it, so I would have to think there'll be an evaluation, as government and Health PEI does often evaluate its programs. I'm sure that will happen as well.
Okay.
Trish?
Thank you, Chair. And I think that's really important because obviously each community is unique, and we have so much to learn, you know, about different ways that we can support healthcare professionals and what that might look like. So I do hope that is happening as well. Just one last question here. You mentioned that you have a relationship with private long-term care facilities and supporting their recruitment efforts. Can you expand a little bit on what that looks like?
Sure. So during the pandemic, the leadership in the department had asked that we as a department provide support in any way we could to the private facilities, because it wasn't just our Health PEI facilities that were being affected by some of the staffing shortages that they were experiencing. And so Lori and myself and a number of others in our department had very quickly started engaging with the leadership from the private facilities, determining what their staffing ratios were, determining what their areas of need were, using a number of different sources to try to provide HR support to them. So whether it would be an RCW in a community care facility, a resident care worker in a community care facility, or an RN in one of our private long-term care facilities, if we had the resources coming available to us, we would make sure we were allocating it between Health PEI and the private facilities. facilities. And so that was a shift in our world from a recruitment and retention's perspective. We've only ever really focused on providing recruitment support to Health PEI, but like I said, through the pandemic, the leadership of the department wanted us to focus on providing that support, and I think it was a very appropriate decision because we knew they were needing support as well.
Trish?
And so that was specifically related to the pandemic. So is that a relationship that you expect to continue for any length of time?
Sure.
We do have an ongoing relationship with that. During the discussions, we decided to set up a working group with representatives from the Private Nursing Home Association. So we brought together the department and reps from Health PEI as well as the association, and we've met twice already, and we're going to begin meeting on a monthly basis. So I think it's supporting that much more holistic approach to supporting private long-term care.
Trish?
Thank you. Okay, and have you, in this process and in this new relationship in supporting private long-term care, have you seen, or has it been a challenge at all in that there might be a range of different staffing relationships, or let's say compensation or vacation time or sick leave or these sorts of things? Have you seen any difference across different private facilities, and has that been a challenge for you in terms of recruitment?
There's definitely differences between different facilities. Some facilities are offering financial incentives, some aren't. So it just depends on the facility itself. And the wage rates, we were doing scans at the time looking at different job postings that they had using Monster or Indeed.com or wherever it might have been to try to get a sense of what their hourly rates were. Some private facilities are unionized and some aren't as well. So that was something else to keep in mind. And as we know, Health PEI facilities are unionized. So there are differences between. What I would say is any of the nursing supports or resources we were able to allocate to some of the private facilities had either worked in a private facility before and were either coming out of retirement or coming from another area and wanted to work in those facilities. And so they would do that knowing the compensation structure. But we didn't really get into those discussions, to be honest, Trish. What would happen is if we had identified a resource, we would provide that resource name and contact information to the facility, and they would engage in the conversations around salary and vacation and schedules and everything else operational. So we allowed them to do that because that's their operational management procedure. So we were just more of a conduit to try to help when we could.
Just one last question on that. So just to clarify then, so as a condition of your support, there was no sort of stipulation around the quality of what compensation and what was available for workers, not just compensation, but particularly I'm thinking about sick leave. That's something that has been a bit of a concern, well, quite a concern across the country in terms of long-term care facilities. And I just was wondering if there was any consideration of making sure that workers in long-term care facilities where the government is providing support for recruitment are also providing at least, basic sort of level of protection for workers in terms of their paid sick leave. No. Okay. Thank you. That's all.
You mentioned you recruited 19 doctors. That's fantastic. How many people, during that time you recruited those doctors, how many people left the province or retired during that time?
I have a recruitment report here for physicians. So when 2020 started, we had a number of physician vacancies that we were already recruiting for. So prior to the pandemic, the recruitment work was underway. And we kind of break down our recruitment efforts in terms of family medicine practices and then specialty areas. So if I was to go back and look at January of 2020, I know there was about 7 family medicine physician vacancies, and then there would have been vacancies in psychiatry, anesthesia, medical oncology, emergency medicine, and I'd have to, some of our other specialties that I mentioned earlier. So urology, nephrology, which we're still recruiting on, but rheumatology and internal medicine, essentially. We had some internal medicine and general surgery. That was another area we were recruiting for. So some of the vacancies existed prior to 2020 starting, and we were in the process of recruiting during the first few months of the year. Others came up throughout the pandemic, and they are now on our posting on our website, and we are recruiting to them. So as of today, we have 10 family medicine vacancies. We have 3 anesthetist vacancies. We have 7 psychiatry vacancies. We have at least 2 emergency medicine vacancies. We have 1 in medical oncology. We have 2 in pediatrician, 2 OBGYNs, and one in pathology. But I will say there's a number of candidates being considered for a number of those vacancies. So even though they're not off the board yet, as in have an individual with a signed letter of offer, we have competitive processes in place where we're interviewing, obtaining references, conducting some of our site visits in the ways we can during the current situation, and we hope to have some of those vacancies filled before the end of 2020.
Excellent, excellent. Yeah, and it's just, we look at the numbers and they don't always, you have to kind of separate them between family doctors and the specialists for sure. Just want to talk about the recruitment, doctors recruiting doctors, because we've talked about it a lot in here. There was some information earlier this year that plan was going to be done by the end of March. It wasn't done, and it's been very, very quiet. And it seems like a big kind of shift in that, especially for your section. Can you let us know when that will be? I know it's not your responsibility. When that will be completed?
Sure.
So work certainly did happen. The Med Society certainly came back with a model which was endorsed. COVID certainly impacted all of that in terms of the work. So we had, I remember, a fairly large meeting. I had just come into this role, and it was only a few weeks after that things really, changed, and our focus certainly became about COVID. So we've recently picked that up in the last few months, and work has been very much ongoing with that. I think we have a really good collaborative, strong working relationship with MSPEI, and as Rebecca mentioned previously, the contract is just about finalized, and it will have to go through both the internal governance processes for approval. So that will be happening as well, and we have been doing some planning on it. So there's actually been a lot of work that has been ongoing, I would say, in the last couple of months. So.
Okay. Yeah. So when you look at when you mentioned before, there would be 3 areas working with that: the medical society, the department, and Health PEI.
Yeah.
Who's taking the lead?
From the Health PEI or from?
Well, just
From each?
For example, who's going to be accountable for the doctors coming in? I know everybody will play a part, but whose responsibility is it to? Where does the buck lie when?
So when we actually implement a process, who's actually going to be accountable for recruiting more physicians? Is that?
Yeah.
Again, I would see this as a collaboration. This is something very different. I think we're the first jurisdiction to try to work something like this. So we have to do planning and process mapping. We need clear accountabilities as to who's responsible for what. At the end of the day, I think we're responsible. If this isn't working, we need to figure out what isn't working and how we fix that and what we need to do. But we need to have those good relationships and, again, clear accountabilities to know exactly, how we need to proceed differently if that's the case. Does that answer the question?
Yeah, I mean, it's a tough question. Is this almost like a pilot? Are we experimenting here? Is it like a 1-year pilot? Is it a 2-year pilot, or are we going to transition to a new style of recruitment?
Well, we're trying, 2 years is what we're looking at now, with an option for longer, obviously. And so, but we do have an evaluation process that's built into it, and that's going to be really important, that we have a strong evaluation process and we have really good, clear communication, I think, with each of the parties does as we're moving through it.
Mm-hmm. Yeah. With it just, if you just recruited 19 doctors, but there's 14,000 plus people on the patient registry that are looking for doctors. Mm-hmm. Now we're talking about using doctors to recruit other doctors. will that cause more of a gap in this process? With taking doctors out to do, it's just a question I've always had.
Oh, you're saying taking a doctor out of practice potentially?
Well, not out of a
to,
practice, but stressing them or, you know, what I mean, is it, you know, the doctors are busy and there's clear demand given the patient registry in Prince Edward Island.
Oh, so I'll clarify a piece that may help with that, I think. We'd be looking at a chief physician recruiter position that would be hired for the program. So that would be a dedicated physician. And that person would really, again, we're trying to build on that credibility that doctors have in communicating with other doctors and
Yeah.
talking about their experiences. So that would really, I think, happen through that chief physician recruiter. Is
Yeah.
that answer?
Yeah, that's good. It's just,
Okay.
there's been a lot of, there's been a lot of questions around this
Sure.
and it's
We're
very
excited.
important.
It's
Yeah.
new, you know, it's, as I said, it's, again, I think it shows the innovative approach that we're trying to take to look at things differently, and I think that's really important. You
Yeah.
can't keep doing the same things and expecting different results, so we're out there really looking to try to do something new.
Perfect. Is the committee okay? Is everybody else? Great. Okay, well, thank you very much for coming in and answering some questions. And what we'll do is we'll take a little recess and then we'll come back just to finish our meeting. Okay, great. we're back, so we're moving on to the fourth thing on our agenda. So I might pass it over to the clerk to talk a little bit.
Yep.
And
So I have attached underneath the agenda there's kind of an updated work plan. And I just kind of ticked off the items that we've either already met on or are scheduled for to come in. And then you'll notice under home care, there's 3 that haven't been ticked off yet. I guess I just want to touch base with the committee and find out, we have 1 Wednesday slot before the house opens. So I didn't know if you wanted to prioritize out of those last 3, or, I mean, it's not like we could add them on to another day or meet on a Friday if that's agreeable. I just wanted to kind of hear from the committee.
so we have 1 date, 3 different groups, basically. So we're just kind of seeing if what's priority to the committee. If we only have 2 potentially, or 3, or what will we do here at the end? That's tough, yes.
Are you saying, Chair, pick one? If I looked at the 3 on the bottom of the list, the one that I would think that would fit in the best to have a chat with anybody would be Island EMS. If you look at all the topics and covered and stuff like that.
Yeah. Again, yeah, we're looking at things through the COVID lens, so yeah, Island EMS would be, well, Heath?
Well, I was wondering if, just for the sake of time, possibly bringing the 3 of them in, do 3 hours, 15-minute, no more than a 15-minute presentation,
Yeah.
tell them, and we could knock the 3 of them off. If we,
That'd be all right, yeah, we'll just,
Questions, even 20 minutes.
yeah,
Yeah.
we could minimize, unless somebody has.
yeah. So we're okay with that? Okay. All right, okay, so we'll try to do that, clerk. I think that sounded like a great idea. So, we'll move on from that. Was there anything else there?
I guess going forward, just because now we will be filled up for Wednesday meetings until the house opens, just if it would be okay with the committee to add to the agenda at the end of maybe the 2 meetings leading up to the house, just go in camera and kind of discuss some report.
Yeah.
Yeah? Okay.
Sounds good.
And that's good.
Excellent. Perfect. So that's number 4 done. Number 5, new business. New business. Just all we have to discuss, and it's up to the committee whether we want to discuss it today or if we need some more time. There was not a motion, but discussion about, recommendations regarding mental health and addictions standalone or wellness kind of department or something in along those lines. I'm not sure if you were you here, Sydney, last week? No. Okay. So that's just where we are. If you'd like to discuss it now, or if you would want to maybe think about it some more. Ready?
Think about it some more.
Okay, we'll think about it some more. We have some time for that. So, so that's number 5. Moving on to number 6. Can I get a motion to adjourn?
So
Hannah. Jeez, everybody.